poverty inflicts the pain of hunger on 800 million people. 50,000 die each day from its effects. More than half are children under the age of 5. World development leaders agree that support of women is key to winning the battle against poverty. The Millennium Declaration, adopted at the United Nations Millennium Summit, commits member countries to promote gender equality and the empowerment of women as effective ways to combat poverty, hunger, and disease, and to stimulate development that is truly sustainable. It is in response to this worldwide call to action that 4 leading development agencies have joined forces. The United Nations Population Fund, with its deep commitment to the empowerment of poor women. The International Fund for Agricultural Development, with its relentless dedication to the rural poor. The Microcredit Summit campaign and its worldwide network of 3,500 microfinance institutions. And Freedom from Hunger, the provider of credit and education to over 300,000 poor families. Together, they propose to initiate a global program to help tens of millions of very poor women and hundreds of millions of family members escape poverty. The 4 partners have chosen to focus on women because women are the poorest among the poor. More than men, they lack income and assets. They are more likely to be illiterate. They are seriously threatened by early, multiple, closely spaced pregnancies and HIV/AIDS. But the partners also understand that women hold the keys to development. It has been proven time and time again that the enhanced status of women dramatically improves the well-being of their families and their communities. The partners have found a way to combine 2 of the most powerful women-directed development strategies: the delivery of health education, especially reproductive health, and access to microfinance services, in a package that is even more powerful than when they are offered separately. Too many women fall prey to illness and impoverishment from pregnancies that are too early, too often, and too closely spaced. Every minute, a woman dies in the agony of childbirth. And in sub-Saharan Africa, 57% of HIV/AIDS infected adults are women. The effects on families and communities are disastrous. Access to reproductive health education and services is vital, especially for poor women living in remote areas that are difficult and costly to reach. Microfinance, with its global reach and focus on women, is the perfect vehicle for the delivery of reproductive health education and services worldwide. Microfinance has been shown to be tremendously effective. A World Bank study involving 3 large microfinance institutions in Bangladesh revealed that as many as 5% of members' households escape from poverty each year. Microfinance institutions have increased the number of very poor people they serve from 10 million to over 50 million in just 6 years. And 80% are women. UNFPA, IFAD, the Microcredit Summit campaign, and Freedom from Hunger proposed to support thousands of microfinance institutions, or MFIs, serving tens of millions of poor women, with 3 important strategies. First, to train the MFIs in the use of affordable poverty assessment techniques to identify and serve very poor women in their communities. Second, to help them cost-effectively integrate microfinance and education in reproductive health, child survival, and HIV/AIDS prevention. And finally, to teach them how to use innovative market research methods to meet clients' changing needs. It is not an easy task to find and serve the very poor. They often live in remote areas. They are easily intimidated by better-off clients. They must be searched out and their confidence won. Yet, affordable models do exist. The Small Enterprise Foundation in South Africa has developed an approach called participatory wealth ranking. Residents of a village participate in one of several groups and rank their neighbors by degree of poverty. The results of the ranking sessions are cross-tabulated to ensure accuracy and to prevent cheating. And in Asia, the Kashpur network of microfinance institutions has created the Kashpur House Index. The size and structural components of each house are quantified in a series of simple formulas that accurately predict the level of the household's assets. And several more promising models that cost-effectively identify those living on less than $1 a day are in the late stages of development. In collaboration with UNFPA and IFAD, the Microcredit Summit campaign has already helped hundreds of microfinance institutions develop reliable poverty assessment techniques. But demand has outstripped resources. As part of this initiative, the campaign will conduct intensive 4-day training sessions to equip more than 600 additional microfinance institutions to find and serve millions of new, very poor clients. Across the globe, microfinance clients come together every week or two to do their banking. This gathering, repeated millions of times worldwide, provides an unequaled opportunity to equip women with life-saving knowledge in reproductive health, child survival, and HIV/AIDS prevention, and to do it with unparalleled efficiency. Freedom from Hunger has pioneered the development of short, focused education modules that can be easily incorporated into the banking sessions. Its partner in Bolivia offers credit with education to over 45,000 poor rural women. When the women meet to receive or repay their loans, they also obtain up-to-date information in such critical areas as reproductive health, family planning, and HIV/AIDS prevention. They are also given referrals to area health clinics. And in each village bank, one woman becomes a distributor of contraceptives in her community. Nowhere is credit with education more critical than in the fight against HIV/AIDS, a scourge that has infected more than 40 million people worldwide. Only 1 in 4 people at risk has received even basic information on HIV prevention. Sub-Saharan Africa, a region with 10% of the world's population, suffers 65% of the world's AIDS cases. Women have borne the brunt of the epidemic. Freedom from Hunger works with several African partners to deliver educational modules that inform women about HIV/AIDS prevention and help them develop the solidarity and self-confidence they need to galvanize their communities into action. The partners of this initiative will use Freedom from Hunger's modules and the Microcredit Summit campaign's network to train several hundred microfinance institutions serving millions of poor women in the delivery of life-saving lessons in reproductive health and HIV/AIDS prevention. In life and in the world of development, one size does not fit all. Marketplace realities are in constant flux from social and economic forces, and the needs of micro-entrepreneurs change as their businesses evolve. If they wish to truly serve and retain their clients, microfinance institutions must learn to use the power of market research to develop new products and services that are tailored to their clients' needs. With assistance from IFAD, Freedom from Hunger plans to work with members of its network in 2 very different parts of the world to develop successful models that other members of the microfinance field can adapt for their own use. In Burkina Faso, as in other West African countries, demand for financial services slows during the months of May through September. It is the main growing season, and women have less time to run their businesses. Repayment rates fall off as well. Market research methods will be employed to develop new loan products that are better tailored to the ebb and flow of women's business activities. And in the Philippines, Freedom from Hunger's partner offers clients 3 powerful financial services: credit, savings, and insurance. But clients do not always use these products to their best advantage. Through market research, an educational module will be developed that teaches clients how to analyze their short, medium, and long-term financial needs and make sound choices. The Burkina Faso and Philippine models will be shared with thousands of other microfinance institutions, so they too can better serve and retain their clients and ensure the ongoing delivery of both reproductive health education and financial services. When women combine hard work and dedication with the power of working capital and life-saving knowledge, they and their families no longer see poverty as a life sentence or motherhood as a death trap. The 4 organizations that will carry out this initiative have a proven history of working together in this field. United, their efforts will equip thousands of microfinance institutions with the tools they need to deeply affect the lives of tens of millions of women. It is difficult to imagine a program that more fully supports so many of the Millennium Development Goals. It is a strong step toward a world where every woman can control her own life and turn hopes and dreams into reality.